Alterations in elimination. This is disorders of the liver, gallbladder, or pancreas. The liver has 4 lobes and it's supported by mesenteries that connect the liver to the intestines, abdominal wall, and diaphragm. It's going to metabolize glucose, proteins and fats, drugs, chemicals, bacteria, and foreign elements. It does convert glycogen to glucose and regulates blood glucose. Stores vitamins. It forms and excretes bile and bilirubin. Synthesizes factors for blood coagulation. Now, liver function will not be significantly affected unless disease is present. Jaundice is a greenish-yellow discoloration of the tissue. It's not a disease process in and of itself, but it is a symptom of disease, often of the liver. It results from an abnormally high concentration of the pigment bilirubin in the blood. It's visibly notable on the skin, in the oral mucosa, and especially in the sclera. And if you try and blanch, like the forehead, instead of turning white when it blanches, it turns yellow. There are 3 forms of jaundice. We can have hemolytic jaundice, which is caused by an excessive destruction of the red blood cells. Hepatocellular jaundice, which is caused by liver disease. And obstructive jaundice, which is blockage of the bile between the liver and the intestinal tract. True or false? Jaundice results from an abnormally low concentration of the pigment bilirubin in the blood. And we know this is false. It's an abnormally high concentration. Cirrhosis is a chronic degenerative liver disorder that's caused by generalized cellular damage. It does have irreversibly damaged liver cells. Consequences of that damage affects digestion and metabolism, fluid and electrolyte imbalances, and an impaired ability to metabolize hormones and detoxify chemicals. There's several different types of cirrhosis. The first one is alcoholic. It's the most common and it's caused by chronic alcohol intake or poisoning or ingestion of hepatotoxic drugs such as acetaminophen. Post-necrotic cirrhosis is destruction of the liver cells secondary to infection, disease, or again exposure to hepatotoxins. Biliary cirrhosis is scarring around the bile ducts in the liver from chronic biliary obstruction and infection or an autoimmune liver disease. And non-alcoholic steatohepatitis is basically that fatty liver is the other type of cirrhosis. Prognosis is dependent on bilirubin and albumin levels, ascites, neurologic involvement, and nutritional status. These clinical manifestations may be compensated and decompensated. We can see chronic fatigue, anorexia, dyspepsia, nausea, clay-colored stools, and diarrhea. They may have constipation, a tea-colored urine or a very dark orange-colored urine, weight loss, and abdominal discomfort, shortness of breath, nosebleeds, signs of incomplete estrogen metabolism in men, and that liver and or spleen might be enlarged, and jaundice. We diagnose with a liver biopsy, blood test, CT scan, MRI, radioisotope liver scan. We can look at nodular configuration and distorted blood flow with that liver scan. So medical and surgical management, there is no specific cure. It does the goal is to prevent further deterioration. We may need to provide vitamins and nutritional supplements. No alcohol. With advanced liver disease, we may have to restrict protein intake and administer lactulose. Ursodeoxycholic acid, potassium-sparing diuretics, sodium intake may need to be regulated, platelet transfusion, and liver transplantation are other possible treatments. Nurses need to monitor vital signs, weight, intake, output, abdominal girth, give small meals, and provide moisturization to the skin. They can develop a lot of itching, which leads to scratching and skin impairment, so we need to keep that skin moisturized. This is due to the toxin buildup in the skin. Clients' response to drug therapy needs to be monitored, including a change in their mental status and signs of GI bleed. And we need to provide client teaching about their disorder, guide them to support groups, teach them about treatment regimens and home care. Complications of cirrhosis include portal hypertension, where the blood backs up into the portal system. We may see congestion that causes pressure, GI bleed, ascites, and encephalopathy. Treatment includes sodium restriction, drug therapy, surgical and non-surgical shunts. Esophageal varices are a result of portal hypertension that actually causes the blood vessels to dilate and bulge in the esophagus. They're easily traumatized, they're very fragile, and they can cause esophageal bleeding that can be life-threatening. So very important that these clients avoid any rough textured food, they avoid straining, they avoid any chemical irritants that can actually erode or cause the rupture of those vessels, because it can cause a life-threatening hemorrhage. Scleropathy, variceal band ligation, and a Singstaken Blakemore tube might be necessary, in addition to IV fluids and blood products. Ascites is another complication, which is a collection of fluid in the peritoneal cavity. This, we see the hepatorenal syndrome, where serum protein has been collected in the peritoneal cavity. These clients may require an abdominal paracentesis, where we have a catheter that is inserted into the abdomen to drain off fluid. We also may need to alter their diet, and we can treat it with drug therapy in addition. And lastly, hepatic encephalopathy, which is going to be a CNS manifestation of liver failure. It can also lead to coma and death, and we definitely see an increased ammonia level in the blood studies. So CNS effects include disorientation and confusion, personality changes, and asterixis. We treat it by eliminating dietary protein, administering lactulose, remove residual protein, and deplete intestinal microorganisms. Hepatitis is liver inflammation after exposure to drugs or chemicals, alcohol abuse, or infection, and it can be acute or chronic. It is a viral infection, and we have A, B, C, D, E, and G. Type A is transmitted through water, food, or medical equipment, and can be contaminated by infected fecal matter. It's rarely fatal. Type B is found in all body fluids of infected persons and is transmitted by intimate contact with carriers and contact with contaminated blood or medical equipment. 6% of persons infected past age 5 will develop chronic hepatitis B with an increased risk of cirrhosis, liver failure, and liver cancer. Type C is transmitted by contact with contaminated blood and medical equipment or infected body fluid. Some people will recover, while some develop chronic infections or liver cancer. Type D is transmitted through the skin and mucous membranes, and we see an increased risk for chronic disease and possible liver failure. Type E is similar to type A and is transmitted through food and water contaminated with infected fecal matter. This type is rare in the United States. Type G is transmitted through blood transfusions. Hepatitis B, C, and D usually are chronic and persistent. Type B and C, we also see the hepatocellular carcinoma. Other types of hepatitis can include autoimmune, toxic, and drug-induced. These clients go through what we call an incubation phase, where they're asymptomatic. The virus is in the blood, bile, and stool, and these clients are infectious. Then we have the preicteric or prodromal phase, where the client experiences nausea, vomiting, anorexia, fever, right upper quadrant pain, rash, and urticaria. With the icteric phase, they experience jaundice, pruritus, clay-colored stools, dark urine, and fatigue. With the post-icteric phase, the liver is enlarged. They may have malaise, fatigue, and this is where that liver tests begin to return to normal. We diagnose with serology analysis and a liver biopsy. And with a liver biopsy, remember how vascular that liver is, so watching for hemorrhage is extremely important. We're going to treat symptoms, provide bed rest, IV fluid, a balanced diet, vitamins and antiemetics, and drug therapy. These clients may require liver transplants and immunosuppressives if they have a transplant. Nurses teach transmission prevention, complication prevention. They should avoid alcohol or minimize alcoholic intake, and liver toxic medications. Different vaccinations, there are some for the other forms of hepatitis, but the one we're going to talk about here is hepatitis B. This is a non-infectious viral vaccine that contains hepatitis B surface antigen. It is indicated for all children, all healthcare workers, and adults with diabetes mellitus. It is contraindicated with hypersensitivity to yeast. This is a series of 3 vaccines, so we need to be sure that we're educating our clients to follow up for those additional vaccines. After a period of time, it may be necessary to get a titer level to determine if their level is still sufficient to prevent hepatitis B. So, question. Which type of hepatitis is passed by the oral fecal route? A.